Hi there. Thanks for taking your time to have a look at this video. I've just made this video so that you can understand the different care plans that we've prepared for our care management in our RPM and CCM. So let's jump right into it so that I can show you how this works. If you're not already using our system, this is basically the platform that we use for our RPM and CCM. And we've made it in such a way that it's quite intuitive. As a provider, you'll have your practice here and you have different practices. Of course, we'll have set up a practice for you, but I'll go straight to the demo version. And the demo version, this is the dashboard for the demo version. I won't spend a lot of time here because I want to jump right into care planning. And it has all different types of parameters and different types of figures to just let you know how your CCM and RPM is going on in your practice. But the part I wanted to show you is on the patient side and the care planning, because that is the core duty of this kind of a system. I mean, you can do it without this, but this just simplifies things a lot more, and you'll see how this happens. So if, for example, I need to see the patients who are on CCM, I just click on CCM, I'll be able to see all the patients in my practice that are on CCM. If I want to see the ones that are on RPM, I can see the ones that are live and the ones that are, I can see them in a list format. The same thing with BHI. If your patients on BHI, you'll be able to see them. And all the patients that have been imported from your EHR, you'll be able to see them here. Okay. So let's narrow down to the ones who are on CCM. And I'll just pick a random patient here, like David, just random patient. And this is the kind of screen that you get when you're dealing with a patient. And it has all sorts of different indicators just to show you how the patient is doing. The one that I wanted to show you right now is on care management, because that's what makes us different from everyone else. We've loaded more than 135 of them on our platform. And what is a care management? In essence, the minute you onboard your patient, we'll have to take them through a care management plan. And what we do is we come here and generate a new plan and click on new. And based on what this patient has, it will be able to pull out the different care plans that can be provided. And these are the care plans that are very different and are so systematic in our practice or in our CCM program that no one else has this, and it makes it much easier for the care managers to do their job. So here are all the care plans that we have, right from simple things to more complex aspects of chronic care. So you can see here, we have the likes of alcohol abuse. We go all the way down to arthritis, autoimmune diseases, bone degeneration, chronic kidney disease. We go all the way to the likes of chronic ulcerative proctitis. And this is, at this point in time, close to 140 of them. So I just pick one of the most common ones, like, for example, I can say hypertension and add that care plan. So what that means is I'll be able to start asking questions in this care plan that are relevant to this patient's condition. And for that reason, we're able to tailor a very specific care plan for the patient that is not copy and paste for anyone else. So I just need to pick the diagnosis code there. I'll pick hypertensive emergency. You could pick more than one. And then after that, I click on next. You also realize that our system is very time conscious. Our time tracking is possibly one at the top of everything else, because that is how we're able to bill accurately. If your time logging is not correct, you're not going to be able to bill. And of course, if you don't bill, you don't get paid. Or you can bill and end up with a lot of denials. So that's what makes us different. So the first point is what we call the general questionnaire. And this is just, how do you rate your overall physical health? I could say, for example, good. And remember, our care managers are on the phone speaking to the patient and answering these questions and correlating that information from what we collected from your EHR, EMR. Okay. So then I could go to the second question. What activities of daily living, the ADLs, do you currently require assistance with. So for example, you could say, I require assistance with dressing, and we have a note section here where the care manager can be able to add the note that goes towards the patient care plan. Okay. Do you have a history of falling? Do you have problems with pain? You explain what it is and you add the note there. So this is a general questionnaire. Now, this happens for every care plan, and I won't spend a lot of time here because there's a lot more that can be done. And remember, this is per patient, and once we ask the patient questions, we always take time to write any notes that the patient has down there. All right. After I'm done with the general questionnaire, then I go to the next one and I set the goals. Now, this is very specific to the care plan for hypertension because that's what we chose from the beginning. So in that case, I'll come and check the different questions and their answers, and of course, put a note on each question. So if the patient responds affirmatively, then I'll be able to put a note on that. And whatever details and information they give me, I'll be able to add the note there and keep going on like that. And you can see the 4 key things here. First one is the goals, and the next one is the barrier. What are the things that make it hard for you to reach your hypertension goals? And this is where you come and say, maybe I'm too fatigued due to physical inactivity. So you understand what the barriers are. After the barriers, of course, symptoms is a compliance requirement. You need to, of course, capture some of the symptoms and explain exactly what they are. But most important is the interventions that we put in place as care managers. And this is, of course, in collaboration with the information that you have in your records. So, for example, the care manager will come and ask questions here that are relevant to the intervention based on the goals that have been put up. And these goals and barriers and interventions eventually become part of the care planning and care progress. So it becomes a continuum of the questions that they're already asking here. Okay. So I just click on next because this might take us a long time. This is a compliance requirement as well. We need to highlight who are going to be the care managers and make sure that the contacts are available to them. The allergies, we have to put any food allergies, any medication allergies is also very important. If the patient is allergic to penicillin, is allergic to eggs, we put it right there. And the medications that they're currently taking, we should be able to add that in this field. And in this field, when it comes to medication, I mean, we've got a whole database of all the meds you can think of. So it's highly unlikely that we'll have something that they're taking which we cannot be able to pick up from here. Okay. Then, of course, the vitals, what are the numbers that we're going to track for this patient? Are we going to be looking at the BP? Are we going to be looking at the BMI? And this is where we also tell us, does this patient need a device? Because if the patient needs to go on RPM, then you're going to make sure that they jump on RPM. Okay. Lab results and everything, we add all that there. And expected outcome. What are you looking at achieving at the end of the day? Is it improve the confidence around the food choices? Is it reduce the risk of complications? Is it reduce the risk of having a heart attack? So that is what we add at the end here. And of course, we put a note to that. And you see the reason why you're putting a note to this, because the care progress that is done on a monthly basis needs to keep a tally of all that. So then we click on next, and eventually we add notes here of how our care plan has gone. And if I click next, I'm finished working on the care plan. I've spent 6 minutes and 15 seconds, or roughly 7 minutes. And this, of course, goes towards the billing of the patient. So when I click on finish here, the system is going to ask me whether I want to log that time. And it's already picked the time here, 7 minutes, 3 seconds. Log as that. My name is there. And I just need to click on save so that we can be able to bill that patient accordingly. This is very, very crucial. No one else has that. And now I can see that for this month, I've spent 31 minutes out of 60, because 60 is where the billable codes come in for the CCM. Okay. Now, if I want to see that report, I just need to click on generate report here while I'm still in care management. I want to pick on all things that I've done there and open review or preview, and you see that it generates a full report. And this is going to have your practice logo and details. Sends that to the patient, and I can click on send there and send it either to the patient or send it to you as the physician or the provider, and that is sent to you. So if I click on confirm there and I say send, that report is sent to the patient and it's sent to you. And that is how we do care planning. I'll set up another video so that I can show you how to do care progress. Hope this has been useful. Ciao.